9:20 yesterday, we talked about enhancing your breast. We're going to do it again today.
Yep.
So you want to get breast implants. You always thought about it, but before you spend as much as $9,000 for the procedure, wouldn't you like to know what you're really going to look like to all of your friends, what your bust line is going to look like once it's enhanced?
Okay, now you can. You can see what you're going to look like before you do this. The machine is called Precision Light. It is a 4D imaging system that has cutting-edge software. It simulates visually and realistically the results of a breast augmentation.
There's only 4 of these machines in the whole country, including one here in Philadelphia, the Philadelphia office of renowned plastic surgeon Dr. Bucky, who joins us now. And you brought something that I have in the box, but we're going to reveal that. That's going to be a surprise here. First of all, tell us about this Precision Light.
Mike and Jen, Precision Light was developed by some very smart engineers in Silicon Valley. And essentially what it's been designed to do is not only help patients see what they're going to look like in 3 dimensions. Many people will go on the internet and look at before and after pictures, and they see somebody and they say, well, I want 300 implants because this picture looks good. Okay,
so we met this nice woman. Her name is Carmen.
Yes.
She agreed to go in there and be videotaped. So she walks into your office, puts on a robe, takes the robe off. You take a picture of her chest, right? Basically. Now, what's the purpose of the photo? What do you do with it?
Instantaneously, that picture of her chest shows her skeleton, her muscles, and her breasts in 3 dimensions. And by doing so, it allows us to look at not only her breast size, but all the asymmetries or irregularities that occur instantaneously.
So some women say that they're unhappy after spending that kind of money. They don't know what they're going to look like before they get the procedure
It's
done.
a giant leap of faith. We can do anything we can in terms of showing photos and putting rice in and jello and all kinds of things in the bra, but at the end of the day, it's a huge leap of faith between what the doctor says and the feedback that the doctor gets from the patient as to what is the right size.
But you could show them pictures of other women and the size and all that, but this is actually a photo of themselves.
100%.
Okay, have you tried it already?
Yeah.
And are people wanting to go bigger or smaller than they originally wanted?
You know, Jen, I was worried that people would want to go bigger. That's a truism in breast augmentation. This is so realistic. Patients say, that's the right size because they can see on me, and I don't find that they go bigger. And that's really the first time I've ever experienced that.
Now, of course, we've had to blur the before and afters here. There's Carmen on the left, more flat-chested, then boom. That's what she would look like if her breasts were enhanced. But then you also show them, you told me that the reason why it spins around like this, you know the #1 way women look at their own breasts? They have to look down, of course.
Yeah.
So you show them that image.
Yes, yes. And actually in the OR, I used to go right up to the shoulders and look down because that's how women notice themselves. We tend to look at them from the front, but when they're on you, you look down at them besides the mirror.
But also women want to know what they look like in a sweater. Okay, what do I look like in this blue sweater? What I might look like in a bikini top or something like that.
Yeah.
So you give them all sorts of different images, and it spins.
They've thought of everything. And I think that the most amazing thing is when you see how a patient views this, and the light bulb goes off and say, this is what I want, or this is too big, or this is too small, you say, this is a very effective tool.
Okay, so before we blow the $8,000 or $9,000 on this, how much is it to come in and have my picture taken?
It's the normal fee for a consult. We have group consults where there is no fee at all, and a private consult's about $150, and it's part of that consultation. And I think it's almost to the point now where I don't think I would take someone to the OR without doing.
I promise people I have a show inside the box. These are simply silicone.
These are silicone implants.
Breast implants.
The interesting piece is that implant and this implant, if you look at them, are the same size. They're just a different shape. And so when people say, I want a 300cc implant, they can be completely different.
One's more like this and one's more stacked up.
Yes, because there are 350 choices today of implants. That's why people need to see what they're going to look like if they can do it.
I got you. Thank you, Dr. Bucky. You have two offices, one in Center City?
One in Center City in Washington Square and one in Ardmore, near Suburban Square.
Dr. Bucky, thank you, sir.
He's talking about money.